Hi there, this is Dr. Avi here, and I'm coming to you today from Kuala Lumpur in Malaysia, where I've literally just attended the IHI, Institute of Healthcare Improvement in BMJ International Forum on Safety and Quality. It's been a two-day conference. It's been a fantastic conference. I've learned a lot about the integration between patient experience and quality and safety, and a whole bunch of learnings. The IHI and BMJ group has been absolutely fantastic. They get a great bunch of speakers like Don Berwick, Helen Bevan, and a whole bunch of CEOs that have led change and transformation in health systems. And there's been some really interesting stories that have come through. And one of the key messages that I've learned that, it's not just about the data. Getting great data on health outcomes and experience is fantastic, but really changing the mindset, the leadership, and capturing the hearts and minds of staff, CEOs, leaders is fundamentally important. Creating that culture change is absolutely critical. The people that I work with, they hear this from me over and over again, but hearing it today was fantastic. A concept called 7 stories, just hashtag 7 stories, a book about it as well, is, find out about your patients and your community by listening to 7 stories that they tell. And 7 stories from the community or consumers or from patients will tell you most of the issues that are going on in your organization. So using stories to create change, absolutely powerful. Don Berwick gave a great speech today, and he, as you know, is one of the key leaders at the Institute of Healthcare Improvement, helped with Obamacare and various other policies. Told a story about his brother and how a lot of what occurred during his brother's stay in hospital and his recovery, despite there being an incredible amount of data from devices, machinery, as his brother was ventilated, what really made a change and a difference was the staff, their interactions, the ability to talk to each other, the ability to work as a team, communicate well. And again, this was reiterated by Helen Bevan, and this concept of taking social action, enabling social action, where you actually have to empower staff and teams and motivate them to create communities within themselves, within the organization, such that they are the ones that help create change at the grassroots level. So a lot of you, sometimes, you keep looking for those process improvements and efficiency improvements, and I get that, and that is part of the change process, but really you have to drive that change in mindset, help people come along that journey of change and improvement, whether that's quality improvement initiatives or patient experience, which is part of that whole piece. You have to be that kind of leader and change maker that inspires others, that helps to motivate others, rather than driving processes, KPIs, and incentives. That is all part of that change process, absolutely, but don't forget that you actually have to motivate people and help create that culture of teamwork, collaboration, and helping build good relationships between all the people that work together. So that's one of my key takeaways from this conference. I'll have a lot more in the days and weeks to come, and please let me know your feedback and how you're doing this in your hospital, or if you'd like any help with that as well. Bye from now from KL, Dr. Avi. Bye-bye.